who yesterday was the picture of Joseph Lister, today will stand in for the man. And he's done an awful lot of reading about Sir Joseph Lister. So I'll trouble you to collect that. Now, I've got a few spares, so we might as well hand them to the table. We'll have more. You've got 5. Can you people manage with one? Now, you don't have to learn this. This is wrong. But it doesn't tell us anything about how it was to be him and what he thought about what he did. Other colours? Good. Now, Sir Joseph, these doctors will be coming to talk with you soon, and will you please remember that if they ask you any questions that are written down there, any answers that are in that sheet, please don't take the trouble to answer them.
No, well,
will you just remind them that they're on their sheet?
Certainly.
Where it was cut off and when it was cut off. Right. Now let's see what good questions you can discuss amongst yourselves to ask me that tells you a lot more about this, because I have to live with this, you know. I have to live without it, and I've got to live with it. I've got to live with having no little thing much, and I've got to live without having half of it. Now, you have a talk at your table and think of a good question that you think will get to know a lot that you'll never write in the books about the facts. And when you think you've got a real good question, ask it after I jammed it in the car door. Yes. Now what we have to say is, was that a kind of, we might have asked this, yes?
Is it like hard to eat and hard to write, or?
No.
Is it still there?
Sometimes.
Does it ever come in handy?
Yes. But I never wear it. Now, I couldn't say yes and no to that question, could I? Now, you have a quiet talk and say, now, what do we most want to know about that thing? Or about Mrs. Heathcote's feelings? Or about the car? Or where they were going at the time? You see? And think, now what do we want to know about really? Now if we look at this one, she said, did the surgeon take any more off? Now really what she wanted to know about was, did the accident do it all? Information from me. Right?
What did the surgeons do? Yeah.
What did the surgeons do to my finger? Well, I wasn't actually there. I mean, I was there, but I was asleep. So when I went... Pardon?
Why don't you wear your last finger?
It's a nuisance. Have you noticed words with, questions with why in can be answered very short? And words like what, and words like who, and words like when. Shall I write the words down that will make it get short answers? You see, when did you have it done? 20 years ago. Why don't you wear it? Don't like it. Who were you with? 2 other people. Where were you? In a car. Can you think of any other words like that that we mustn't use to get good answers?
How do you mean by nuisance, you think it was?
Ah, now that's quite a useful one. How? How looks as if I have to talk a lot more. Shall we put how over here? I'm going to put a plus on that and a minus on that, shall we? Try a few how questions about my finger. Have a word about how. See if you can get some information.
How did you feel? Just as you drive to do.
Oh, I felt. Did you hear what she said? She said, how did I feel? Like, see, how is one of those words that's about being like something. You know, I was in that state. How did I feel? First of all, I was very surprised, astonished. And then I got a very big pain. And then I felt very sick. And then I sort of started to feel really miserable. Now she got 4 hows, didn't she? Any other good questions with Howie?
How did you think I feel after you'd had after it's been bandaged and that?
It felt very tight round very quickly because it's short. It makes a very interesting drawing when you draw around your hand. People think that's a very strange creature that's left its mark. It makes people want to know, and there's always something to talk about when I meet strangers. There are all sorts of useful things.
Bandages does it have?
Well, people stare at it sometimes, especially little children who say, hey, she's not got a finger on her left hand. Sometimes it hurts in the very cold weather. And sometimes it feels as if the other part is still there and I forget. And I pick something up with the other bit that isn't there. They say that's true of arms and legs as well. And I drop cups if I try to pick up something and think it's still a whole finger. Because I can remember exactly what it feels like. It's also very stiff. I can never bend it like I can bend this. Right, do you think we've practiced enough on these? Now, of course, I'm very calm and ordinary because we're just talking theory so that we know it is a new examination. Now, yesterday we only allowed you to meet the historical instruments. Today you're meeting the historical person. And everything you find out about her, are you? Yes. May I introduce you to these doctors? They've taken the trouble to travel to meet you and to hear about your work. They realise that you haven't time for a big lecture, and so they have certain questions they'd like to put to you. Will you mind if they have a little discussion first?
Oh, not at all, I
Very
understand.
well. You'll wait here till you find out what you want to know, and then it's up to you. No, just go and ask him. Oh, look over and ask him. Ask him loud enough so that he can hear well, you know, because...
Yes, a good question for young doctors. I might just speak so everyone can hear. Someone's just asked me what my feelings were like when I was doing operations. Well, one of my feelings was that I had to be very quick. Speed. I was always conscious of how much time I was taking.
Excuse me, Sir Joseph, may I just have a word?
Yes, yes.
I don't understand that. Why so fast? Pardon? You mean the patients might die fast? Oh, it's to do with losing blood. I don't know. I'd like to know more about that. I'll have to think of a question about it.
How did you feel when you discovered unaccepted?
Ah, that's a good question. Someone's asked me how I felt when I discovered antiseptic. Well, it's hard to say because it was such a long process. I felt surprised at first. I was amazed by the things I'd read in books that helped me discover it. How else did I feel? I felt that I'd have to change my whole way of working, my whole way of surgery. That's something I felt. Very interesting to know. Has anyone got a reason they can tell me why they chosen this profession? And I'll tell you whether it's close to mine, the sort of reasons I had. What is it, I wonder, that drives people to become doctors?
To save people from dying?
Yes, well, that was very similar to the sorts of thoughts I had. To save people. Anything else?
It's a good experience.
It certainly is. It's a wonderful experience.
It must be nice when you just save somebody's life and they're all very thankful to you.
Well, they are very thankful. I remember when I worked on a boy called James, what was his name? It was a long time ago now. James Greenlees. He was only 11. And a cart ran over his knee, just here. And he'd broken his knee. And he'd broken it. It was a compound fracture. You know what that is? You haven't come to that yet?
We haven't done modern medicine.
Oh, I
yet.
see.
Some of them may have a good idea of it.
And the skin was broken. And of course they thought he was going to die. About every second one did. But he recovered. Every time we open up the body, we have to be very careful.
If you feel that you ought to take a few notes now, to be sure you don't forget anything, you know. I'm not pushing you, but if you feel, just come over when you have something to ask and take your notes and keep coming backwards and forwards. And then that way you don't have to wait for each other all the time, you see.
What are the rooms that you
The rooms? Well, in Edinburgh we have very good rooms now. We have lots of light and the air. Make sure the air is very clean. Most important. Most important. Clean air.
What about precautions to take?
Sorry?
What about precautions to take?
Well, it's interesting. Precautions. Well, of course, the most important precaution we do take is to put all of our instruments in a carbolic acid solution to keep them clean.
How long does it take to do an operation?
Well, we certainly take more time now. We don't have to rush as much as we did. So it takes a lot longer than it used to. Well, I felt very, very grateful that I'd been lucky enough to come upon this new technique. And I was very happy to see someone who was saved.
Did anyone in your patients die?
Oh, yes.
Did you like it when they had died?
Well, I felt very, very sad because I felt that I could, if only I could have perfected my method, and if only those others had listened to me, I could have saved them. I felt that people died if they shouldn't have died. Well, it depended on the disease. Some diseases we could cut the diseased parts of the body away, but there are others that I'm afraid I couldn't do much for. We tried to make them comfortable, but, well, at least in my wards we tried to make them comfortable. Well, I'm afraid some people weren't so helpful. Well, I think the worst accident I've been, I'm not very happy with, I'm afraid. People are always asking me how many patients I've lost. They should be asking how many I've saved. I think, anyway. Would you like to rephrase that question? Well, now that's a good question. I think I can say that we've almost halved the incidence of loss from major surgical operations. So we've saved half those people who would have died. Well, yes, it was my father. He first bought me a microscope when I was quite a young man, and he encouraged me in scientific experiment when I was very young. He felt, of course, that I shouldn't be a doctor straight away, but he was very, very helpful, very helpful.
When you discovered antiseptic, was there any other things that we discovered?
Well, I've published many papers, and I'm quite pleased to say that I did some work on catgut that I thought was very useful for surgery. Yes. Oh, sorry.
How long does an operation take you?
Well, I'm glad to say that the operations that I perform can take quite a considerable amount of time, up to 20 minutes or half an hour, or even longer, because I've got the time to spend now, of course, unlike in the old days. Have I ever had this? Yes, when I was a young man, just finished university, I was very tired from so much studying, and I got quite weak, and I had to, I didn't have to go into hospital, but the doctors recommended that I go away for a rest. So I went away into Scotland for a holiday, a long holiday, and that fixed me up. But I've never actually been in the hospital till I run myself.
Do you always feel depressed when you try out an experiment?
Now that's a very good question. Yes, I'm afraid I do feel depressed. I often feel depressed, not so much about the experiments, but about the people that are around me. Because some of them really, not so much in of course, Edinburgh, but in Glasgow, I don't know. These people do make me depressed.
What was your longest operation?
Well, of course, operations today do take longer because of the chloroform. So we normally go up to a half an hour or 3/4. They do feel worried, and some of them, I hate to say, don't even understand what's going on. They're not the only ones. Some doctors don't know either. I've had to send patients away from my hospital. There was one young man compound fracture of the leg. I put on a zinc covering, carbolic putty and zinc covering over the leg, and you know, he would not stop touching it. He was forever lifting it and looking at secondary infections, one after the other. In the end, I discharged him. I mean, I couldn't do anything for the man. Couldn't do a thing for him. He kept lifting up the carbolic putty and the tin sheet, exposing his legs to the air, reinfecting himself. 170 days in hospital, his leg still wasn't healed. I had to discharge him. I tried to explain to him about antisepsis. He wouldn't understand, but he's not the worst. Some of those London doctors, the sort of questions that should be answered with statistics, because these people are forever saying to me, "You haven't saved anybody. They would have got better anyway." You listen to this. Listen to what this man said. Simpson. Mr. Simpson, he says that my work does not help people at all, it's just general cleanliness. He says cold water would be just as good as my work. It's ridiculous. Cold water. He didn't like it. Sorry? Many of them. Do you know that I've had patients come to me and they said, "You're not going to put carbolic acid on my legs because it'll burn." And I said, "It's the only way you're going to survive." Would they listen to me? No. They wouldn't listen. Not only them, of course, it was the doctors in London. They were the worst. Cold water. Yeah.
It is a man that just sort of works down a cold.
Well, you see, it's a problem. I didn't ever amputate unless I knew the person was going to die anyway. So, it was a matter of, did you want to live without a leg, or did you want to die? There was no other way. Because once the gangrene set in, once the wound was starting to rot, there was nothing to be done. There was nothing to be done. Offer had to come, antiseptic, the only way. The only way. But of course there were many who said that I was just a quack. And they said carbolic didn't work. I will admit the spray wasn't. I will admit that the spray was perhaps overdoing it.
Did you know what
Well, Simpson was the professor. I'll read. Let me see. This is what Simpson actually said. One great and most laudable object which Professor Lister has in view of using carbolic acid as a local dressing for wounds is to close these wounds entirely by first intention without suppuration. And then he goes on and says, these results, that is, fixing the wounds without making them really bad. He said, these results have been obtained in the hospitals of Aberdeen without using my techniques, and of course it's rubbish, as all you doctors well know. Absolute rubbish. I was attacked in the medical papers, in the Lancet, time and time again by ignorant fools. And to think they were Scotsmen.
Sir Joseph, I hope you're not upsetting yourself too much.
No, it's quite all right. I'm afraid I become prone to attacks of depression when these people are mentioned. I'm sorry, it's just the questions bring back in my mind these problems I've had.
I see, yes.
What is the funniest case you've ever had?
Funniest? Well, I'm not a man for humour myself. I don't think you can say that I've had much that's been funny. In fact, the hospitals are very grim places.
Ladies and gentlemen, may I just have a word with you? Excuse us for a moment.
Oh, certainly. I must get on with my reading.
there's a very important question coming up, and I feel that we should all be able to pay attention to it. It's being asked by the young doctor here, and it's to do with the kinds of tests that Sir Joseph himself applied in his own career. Now, I feel that one of the things we could do here is, if he explains his kinds of tests, he may want to know the kinds of tests modern doctors apply to check out if their work is suitable. Would you be prepared to risk him asking you that question if we ask him it? To try and answer? Would you? You see, I can't say to him, we'll ask you questions and you've no right to ask us questions. It doesn't seem very fair, does it? So it's a matter if he says, well, what kinds of tests do modern doctors use about anything to show that their work, they really are curing people. I don't want you to be too upset by that question. I'm sure we could answer it between us, couldn't we? What do you think? Shall we risk that question? Let's therefore stand and ask it like the students did in the day when Sir Joseph Lister used to have to lecture. Sir Joseph?
Yes, yes.
Would you mind helping us put ourselves in the right places so that when you used to lecture to young medical students, we are standing or sitting like you are used to?
Certainly.
Is that possible?
Oh, certainly, yes.
Did you lecture in your operating theatre?
Oh, yes, we certainly did. We used to have a semicircle of seats around, so I could, so everyone could see. The angle was there, the patient was here, and I used to lecture before I operated, never, of course, while operating.
I see.
Always before.
So we should be in a semicircle, so
Yes.
that we could be watching you.
Yes, that's correct.
Well, could we do that? Let's stand in a semicircle. We can't sit, I'm afraid.
No, no.
I'll start it at this end, if you can get the semicircle.
Yes. I think if some of you stand over there.
Yes.
Over close there. A nice semicircle, yes. Another couple over here. Two there. Right. And a couple over there. And the rest of you over here, I think. That's right.
Did we have to do anything, Sir Joseph, before we came into the operating theatre?
Well, of course, I always insisted that people who are my students had to go through a procedure. And part of that procedure was in the operating theatre when I turned on the spray. And also, of course, I liked my students to be clean. Their hands, of course. As long as you all have clean hands, I think that would be enough. Very important. Of course, that did cause trouble among some of the students, but they gradually learned.
You mean they disobeyed you?
Well, sometimes they stayed away altogether. They didn't come. Yes, now, what would you like me to...
Well, one of our younger doctors here has a question to ask you, Sir Joseph.
What kind of tests did you use to find out that the antiseptic was really working?
Well, I'm glad you've asked that because it's one of the really important questions I find. Well, would you like the long answer or a short answer here?
Anything really?
Right. Well, could I have the feeling of the group? What sort of what answer would you like? Would you like the long answer or the short answer here? Well, I hear some people saying long. Is that the feeling, the general feeling of your doctors? Well, I'll start, but I must warn you that when I gave the long answer to a group of doctors, supposed professionals in London. They yawned, some of them grumbled, some of them even said, "What's this got to do with surgery?" Out loud. Very rude, I felt. The long answer, you have to go back to the work of Louis Pasteur. No doubt you've all heard of Pasteur's work. And you have to go...
What did you say?
The great French doctor, Louis Pasteur. You've all heard of Louis Pasteur, right? Well, I see that some of my colleagues have heard it. Don't tell me you haven't heard of Louis Pasteur.
Well, tell us about him then, if you've heard of him. I'm just the registrar around here.
I don't know much about him, but I've heard his name and I've seen his name in some books.
Well, open the body, these dust particles with the germs in them float through the air, and especially the air of cities like Edinburgh and Glasgow, which is and has been particularly foul, they float into the wounds, and this causes all the problems we have with secondary infection. This is what I believe. In my experiments, I've taken flasks like this. Actually, more like this one here. This isn't exactly the sort of flask I did use, but it's similar. I take a flask like this, and I'll fill it with blood, or I'd fill it with a broth, a beef broth, and I'd seal it. I'd boil the broth. I'd put a muslin cloth over the top here, and then I would draw out the glass tube thin on this end, so it was still open, so the air could still get in, but the germs couldn't get in because they couldn't get through the bends in the glass tube. And then I would put that somewhere and leave it for days and days, and what do you think happened to the blood or the beef broth inside the container?
May we have a moment to discuss it?
Certainly, certainly.
So it didn't change of itself, it was all the germs that made it change. What do you think? Sir Joseph?
Yes, yes.
We're ready to tell you what we think.
Very good.
Anybody?
Yes. Yes. What would you say?
I think it'd dry up.
But there wouldn't be any germs in. It's supposed that blood only lasts 3 days before it dries up.
Excellent. We have two answers here, and both are correct.
I believe there's a gentleman over here has an opinion to express.
Well,
Does it dry up?
it does dry up, yes. It does. But more importantly than that was your answer. What was that again? Can we hear that?
There's no bacteria or germs in it.
Excellent. There were no bacteria or germs in it, so it didn't become infected. But they wouldn't believe me, of course. They wouldn't believe me. The doctors in London, they didn't want to know about that. I took those flasks around time after time after time. I showed them to the people. I said, look, this flask has had blood in it for 3 years. It's had beef broth in it for 3 years. And it's perfectly clear. And the blood is perfectly good. But they said, oh no. They said, they just wouldn't believe me. They said I was a quack. Spontaneous generation.
I still don't understand how he proved it. I mean, in the National Health, we're always being asked to prove it. Aren't we? Prove that you need this ointment to do this thing. Prove that this will put the patient to sleep. Prove that you can make a heart beat in another person's body. I mean, we're always being asked to prove things. Sir,
Yes, yes.
there's a gentleman.
Oh, sorry.
Would you like operate on animals first to see if things work?
Oh, yes. I did numerous experiments with animals, especially in association with my work on catgut. Of course, they disapproved. The Queen disapproved. But still, I was determined. I knew I was right.
Did the people die before the operations?
The people died before the operations. Which ones?
The ones that have got diseases.
Oh yes, many people died before we could even get to them. Is that the question you're asking? Maybe I'm not quite hearing right. Would you like to rephrase the question? You'd like to think about that and give me another rephrase that, perhaps. Proof is what you want, is it? You only have to look at my wards. See the number of major amputations. In Newcastle, there was up to 50% of those people who had major operations died. Major amputations, they died. With my method, it was reduced to 12%. I mean, how can you argue with figures like that?
Thank you very much, Sir.
Well,
for the rest of the examination, I think it's important we now get down as much as we can about what we've been able to learn in this one brief visit with Sir Joseph. Can you do that? You don't have to worry about your writing being specially good to read. Make quite sure you get everything in your mind down onto the paper. Could you do it as quickly as possible? Thank you. 5 minutes. Take it in short notes if it helps you. Anything you're not sure of, hurry on. Ladies and gentlemen, it is time for this part of the examination to stop. However, to write an examination question, each one of you to write the answer to an examination question, and this is the question which I shall leave here, and I hope you will invigilate it afterwards. The question is, and perhaps Sir Joseph will be very interested in this question, what do you feel were the problems that worried Dr. Lister during his lifetime in his work? What do you feel were the problems that worried him? Now, I shall leave this with the invigilator so that you may do the answer before tomorrow's examination. This is part 2 of your History of Medicine examination. Will you please leave your papers, your pencils here in the examination room, and I shall see you tomorrow for the 3rd part of this university program. Thank you very much, ladies and gentlemen. You may not carry out of the room your numbers. They must be placed here as you do. Or you may give them to Dr. Lister today. Thank you.
thank you, Doctor.
Thank you.
Thank you, Doctor. Thank you. Thank you, doctors. Thank you. Thank you very much.